About wound healing. When there is a bleeding in some blood vessel and tissues, what will happen? Will be clotting formation. Within 4 hours, this fibrin forms. First physiological response is vasoconstriction of the blood vessel to control the bleeding and to form a fibrin deposition and form a clot. Then after vasoconstriction, there is vasodilation will be formed to causes leakage of the plasma proteins in 15 to 30 minutes. In 15 to 30 minutes, neutrophil will form, and then 2 to 3 hours after that, macrophages will come, and also basophil mast cells will form in 4 hours. So basophil mast cell lost their granules, causes itching and other things when there is a wound in our body. So first is within 4 hours there is a fibrin formation. In this that neutrophil and macrophages will be formed. Then 4 to 12 hours is leukocytic infiltration. The neutrophil, eosinophil, basophil, lymphocyte, monocyte, we know that. So then lymphocyte and monocyte will be formed within 12 hours. Edema will be there, and then there is fibroblast is there. Fibroblast forms, mitosis will happen in 12 to 24 hours. Then 24 hours macrophage will be increased, and it removes the removal of the necrotic debris is done by this macrophages. So lymphocyte and monocyte leukocyte will form, and the mixaging of this lymphocyte and monocyte and fibroblast, this mitosis starts, and macrophages will remove this necrotic debris. So within 4 hours, fibrin formation, neutrophil, basophil, macrophages, then lymphocyte and monocyte will form, and for eating this necrotic debris, macrophage will increase. That is in 4 to 12 hours. Then 1.5 days, that is myofibroblast. That is between smooth muscles and myofibroblast is there, that forms laminin and heparin sulfate proteoglycan is there. In 2 to 8 days, leukocyte will be in the peak position. Leukocyte within 2 days, the leukocyte will be increased in its peak, and the keratinocyte appears. And there is formation of new capillary formation, that is lipophages, erythrophages, siderophages, hemosiderin. And in the 4th day, there is myofibroblast will be there, collagen formation. In 5th day, around this giant cells there is necrotic debris are there. Myofibroblast acting positive and reepithelialization occurs in this stage. We know that granulation tissues contains blood vessels and fibroblast. Blood vessels will form new capillary formation, lipophages, erythrophages, siderophage, hemosiderin, and fibroblast will form collagen. And on the 5th day, this necrotic debris, the giant cells, and on the 8th day, hematoidin, lymphocyte hematoidin. Then 10 to 14 days, this vascularity decreases, cellular reaction decreases. After 2 weeks, it increases the collagen and elastin, and it will be dense formation. Thank you.